Hi everybody, I'm Dr. Anthony Crifase, functional medicine practitioner and double board certified clinical nutritionist. And in this video, we're going to be discussing leaky gut laboratory testing and the laboratory tests that we utilize for our leaky gut patients, both here in our clinic as well as remotely all over the world. So, if you're dealing with leaky gut or suspecting you are, make sure you watch the end of this video, or if you know someone, a loved one, family member, friend, who's dealing with this type of issue, make sure you share this with them, like this information. We're gonna be going over some great stuff here today. All right, so what is a leaky gut? Remember, leaky gut syndrome is essentially if you left your screen door open on a hot summer day and you had holes in that screen door, what would happen? Well, bugs and other things would start flying into the screen door that you don't want there. So that's essentially what can happen with the leaky gut. So with leaky gut, things are leaking into the bloodstream that don't belong there. So let's draw a picture of this really quickly. So here's your digestive system, okay, your digestive tract. We're gonna draw this here, okay? And in your digestive tract, it's only one cell layer thick. Now this is very important, okay? It's only one cell layer thick, and there are proteins that help stabilize the digestive tract, okay? So they stabilize this digestive tract, all right? Now what can happen is when these proteins become too loose or too wide, which can occur from a variety of reasons, what this does is it creates an immune response and things start to enter the bloodstream. So now you open these up and things start to enter the bloodstream. Stuff such as foods, chemicals, toxins, nearly anything. Stress can even cause this. So this is again why we have to take a big picture approach for all of our patients. No matter what they're suffering from, we have to look, step back and see and address their whole big picture health. We cannot just look at the symptoms because that's a very, very small approach to actually resolving a condition. Symptoms are last things to show and one of the first things to leave. So you can have dysfunction for years and years, and then one day all of a sudden you get symptoms. And the symptoms are often the easiest thing to get rid of. It's the dysfunction that lingers, and you have to address the dysfunction, because if you only address the symptoms, well, the dysfunction still is there. So you have to address the underlying root causes for all of this stuff. So food chemicals can enter the bloodstream. Now, that is essentially what a leaky gut is, okay? We have a lot of other videos on this, so if you're wondering the mechanisms behind that, I would suggest search on those and get a really good understanding, much more. But today, for the laboratory testing that we utilize for our patients with this, the first one, among many others, again, we have to look at this from a big picture approach, but the first one is known as zonulin. Now, it is zonulin, which is a protein that helps stabilize these intact junction in between our cells. These are known as gap junctions. So zonulin helps stabilize these junctions in between the cells. So for leaky gut patients, what can happen is zonulin does elevate from meal to meal. It elevates all the time. However, if you're reacting to zonulin, we know that there's actual dysfunction within the gut lining. So this is something that we're able to identify specifically. We're not gonna go into the great detail on each of the markers, but this is the first one. Okay, the second one is known as actin. Now, you have muscle all over your body, and there's three types of muscle. You have skeletal muscle, such as in your bicep. You have cardiac muscle found in your heart, and then you have smooth muscle found in things like your organs, such as the digestive tract. All right, now the important thing is that actin is found all over the body in these different types of muscles. However, you have specific forms of actin all over the body as well. So the actin that we're able to look for is specific to the gut lining in the digestive tract. And when we have elevations or imbalances with actin, or you're responding to actin, reacting to actin, we know that there is inflammation and toxins within the digestive tract that's causing an issue. Again, leaky gut syndrome, we're able to identify and test for this, but often leaky gut is caused by something else. So we have to look at other aspects and facets of the health and a whole health history to really get a good understanding of this. While we can simply fix leaky gut, it's more important to find the underlying issues why you have leaky gut as well in the first place. But to identify it is also important, very important. So actin is another marker that's crucial. And the third one, which gives us also a lot of important information, is known as LPS. So this is called Lipopolysaccharide. So lipopolysaccharides, that is what LPS is. Now, You might be wondering, what does this mean? What are lipopolysaccharides? Okay, lipopolysaccharides, lipo means fat, poly means multiple. There's different types, right? And saccharides is sugar. But the bottom line is that LPS comes from bacteria. These are toxins. Okay, these are specifically known as endotoxins produced by bacteria, specifically gram-negative bacteria in the gut. So you have gram-negative and gram-positive bacteria in the gut. We're not going to go, this is dealing with the staining process, how they figured that out. Bottom line is gram-negative are often the bad guys in the gut. All right, now remember, your gut, also these bacteria, your microbiome or the microflora, the microorganisms found in the gut, help to stabilize zonulin and can help these gap junctions keep intact and tight. So you want a good microbiome, or you can get what's known as dysbiosis. So we'll put these terms over here. So you want a good microbiome, all right? Your microbiome is found in the gut. This is a big term for the gut cells, okay? When this is imbalanced or in a poor ratio, you get what's known as dysbiosis. So dys means an imbalanced, biosis, essentially the bacteria, the biological organisms in your digestive tract. When you have dysbiosis, this can give you more LPS. You know, we see so many patients who have gut infections from bacterial to yeast, fungal, viral, worms, parasites, and also an overall imbalance in good to bad bacteria in the gut. And this is why we do specific stool testing, a DNA genetic stool testing for a lot of our patients as well, because this is crucial information to find out. And without that, it's really hard to know. You're going to be guessing all day. Essentially, what LPS? So lipopolysaccharides, we also are able to look at a number of different types of these, how your immune system is responding to them, but also where they are and how you're reacting to them in the gut specifically. So these are some major tests that we're able to run that we do for our patients dealing with leaky gut and leaky gut type symptoms. Remember, leaky gut is related to so many different health conditions and so many different symptoms, from delayed food allergies or food sensitivities to autoimmune conditions to chronic health in general. Many different types of symptoms: joint pain, headaches, skin rashes, fatigue, bloating, digestive problems, you name it, it can lead back to a leaky gut. So really, really important. And we utilize specific therapies to first obviously test for this, but then also to restore and revitalize the gut. So I hope this video helped you. Again, this is leaky gut laboratory testing that we commonly utilize among others to really help patients identify and get back to health, find the root cause. So again, I'm Dr. Anthony Crifase. If you're dealing with leaky gut or know someone who is, and they'd like to get this testing done, or you yourself would, I work with patients both remotely as well as in person in the clinic. So our information is below if you are in need. Hope this video helped you. Again, I'm Dr. Crifase. Thank you so much for watching and have a great day.